Edward White. I'm 57 years old. I'm an entrepreneur, and my melanoma journey started in 2020. So go ahead, you introduce yourself.
My name is Antoinette White, and of course, I'm his wife. And as a caregiver, it was not an easy road, but we made it through.
Talk about how my journey started with me. First in contact with melanoma was in 2020, and it was in my fingernail. So it was basically once I got diagnosed with it, the schedule to have my finger amputated, I caught COVID pneumonia. So I ended up in the hospital for 2 weeks, and so when I came out of the hospital, I had to wait another 3 weeks for me to be cleared. So they amputated my right trigger finger, and that's where they found the Acral digital melanoma there. And it was something kind of, it was real scary because as an African American, we don't think we could get skin cancer. After they amputated my finger, I got a phone call from an oncologist that the melanoma has spread it up to my right lymph nodes. And my anxiety went up to the roof. They said I was in stage 3C. And as I was getting prepared for that, my doctor started me on Keytruda. Keytruda did the job, and I was in remission from 2021 to 2024. So that's when it came back in 2024, April of 2024, and it came back with a bang. It hit my right lymph nodes again up under my underarm pit, but it metastasized to both of my lungs. So as the doctors, they tried multiple immunodrugs on me, radiation. My wife advocated for different immunodrugs, and I was at the whip's end. They were asking us, do we have our affairs in order? The chaplain was coming in daily to see me in my room. So that's when, my wife and my oncologist advocated for TILs therapy. So
yeah, during that time when they were telling us to get our affairs in order, I was doing my own research in regards to the TILs. When Dr. Badia first brought it to us, it was not a first option, which it should have been, but it was not. And then when things start to turn, I insisted and I showed him the research that I had done. And that's when he agreed to send us to the Brown Cancer Center. And at that time, when we went to the Brown Cancer Center, we were grateful and happy that we were sent there. But the experience in the beginning was not good at all. They had a student to come in like you normally do, right? When you are in school, you're doing your rotation, and that's normal. We're okay with that. But this particular resident mixed my husband's chart up with someone else and basically said that she wasn't sure why we were there because she didn't see anything that had metastasized. And we were trying to explain to her that she had the wrong file or something was wrong, and she was very adamant. So then the other side of me came out, still professional, and I asked her to leave the room and to go get Dr. Chesney. I didn't want to see anyone else. He eventually came in, apologized, cried with us because she did make a mistake. From there, we knew that my husband was a candidate for TILs, and that's when the nightmare began. After they approved, saying, yeah, he was definitely a candidate, then we had to go through the insurance process. Insurance denied us. So I started reading the federal regulations because of my background. And once I realized that they had made a mistake, I started making all these phone calls and no one was listening. So then that's when I made official complaints. I strategically made official complaints with the White House. I made a congressional complaint, and I also did an attorney general complaint in regards to the denial. And I justified why the denial was wrong. So within
I
think like within a week or something like that, I got a call back from an executive over at TMVA explaining that, how expensive the surgery was, which I couldn't have given a fat rat's behind. But the bottom line is that they approved the surgery. So I asked them to send me a letter. They did. They emailed it over. And then I called Dr. Cloker down at the Brown Cancer Center. And he wanted to know what I did. And I told him exactly what I did. And he said, well, can we use this? And I said, yes. So the fight wasn't over. I mean, it's helpful for us, but it wasn't over for the next people. But once we got the approval, that's when everything started. And his treatment started on December
31st of 2024.
Yeah. And then at that time, everybody was very nice.
The procedure works. You got to do your own research, and you especially don't take no for an answer when it's dealing with insurance companies. And advocate for yourself. I tell my wife is the best advocate. I don't know where I'd be without her, because she was advocating for me. Even she already got me to the TILs therapy, but she had to advocate for me in the hospital because. The guy that, like she said, that was over the bone marrow, he was over everything, but he was trying to send me home early. And my wife knew me. It had derailed my speech a little bit.
And you could probably tell,
it derailed, it derailed my speech, and because I was so weak, I couldn't argue with these people. So my wife, she stood tall, and she advocated for me. And
we would tell people that the TILS procedure, it really works. It does. So the person needs to bet on themselves, give the procedure, try. If it's presented to them, they have to prepare their mind and their body. They have to do their own research and don't take no for an answer, especially when it comes to insurance companies. They have to advocate for themselves and trust their own intuition. If they want to live, they shouldn't hesitate to give TILs a try.
And I thought about me as being, why me? I'm having so much bad luck, but I had good luck because it was FDA approved in 2024. This is time for me to get it. So,
and some of the bad things or not so good things that we went through, it all ended up on a positive note. So again, we would tell anyone who is thinking about TILs, they need to bet on themselves. Yeah. Trust their intuition. It works. You want to live, you want to see your grandkids, you want to see your kids graduate from high school. Even if it gives you another week, it works. And we are living proof.
I was asking God, why me? And that was just on my mind a lot. Why me? And he said that I was the strongest one that can tell everybody. So that's why I picked you.